Hello, and welcome to another episode of Social Workers Rise. It is your host, Catherine, here. Today, we're going to be talking about my experience with hospice social work. So, trigger warning here if any of these topics make you uncomfortable, one, you might want to work on it, but two, I just want to give you the heads up as far as the trigger warnings. I will be talking about death and dying. I'll be talking about ethical dilemmas that come up commonly in hospice social work. I'll be talking about the afterlife. And in addition to those, I will also be sharing what the role of a hospice social worker is and what kind of salary you can expect and where to get started if you're interested in pursuing this career for yourself, either as a new social worker or as a seasoned social worker looking for a little career change. So, first off, welcome. If you don't know who I am, my name is Catherine Moore. I'm an LCSW based out of Southern California. I do therapy, teletherapy mostly, and then I've done a lot of work within the medical social work field, working with hospice, working in palliative care, working in hospitals, both inpatient and outpatient settings, and I love it. I love the field of medical social work. And to be honest, between you and me, hospice social work was my favorite. I did this for about 4 or 5 years, and this was how I got licensed in my LCSW. So, anyone who tells you that hospice social work does not qualify as something to get licensed in, they are lying to you, my friend, at least based out of California. So, full disclosure, my experience is going to be based out of California. Where you are in the state that you are, you may have different rules and regulations, especially related to licensing and the type of experiences. But for the most part, hospice is going to be very similar wherever you go because you're going to be dealing with a lot of the same challenges as far as end of life because we're all human and we all have the same human needs at the end. So hopefully my experiences and my stories give you some insight and maybe pique your interest a little bit in hospice social work. I'll tell you first, when I first got assigned for hospice social work, I was a little scared and intimidated because my prejudice was that everybody's going to be dying and it's going to be super depressing. And what am I going to do? How am I going to help someone who's dying? Like what can I do? Right. So this was my prejudice going in. And I remember the first day shadowing a social worker, I walked in to this person's home because we visit people in all sorts of different settings, in their homes, in nursing homes, not in hospitals. But once they get released from the hospitals, if people are homeless, we will go and visit them wherever they are currently at. But for my experience, my first job shadowing was we went to this gentleman's home, and I remember thinking my first impression was, oh my gosh, he's so alive. He's so talkative, because I thought everybody was just going to be there on the bed, too sick to talk, but that is not the case. And if you are having any kind of prejudice or thinking this is going to be so bad, it's so depressing for any setting that you're in, give it a chance, because chances are it's not going to be that bad. And you're making this out to be way worse than it probably is. So give it a chance. All right. And my very first hospice patient as an intern for my MSW, I was so excited and I was so proud of myself because at first I was so scared. I was so nervous to go in and talk to somebody all alone, like no other social worker there. It was just me and this person. I remember it was in a nursing home, and I walked in and I introduced myself, and I was so nervous, but I got through the initial psychosocial assessment. It went great. The patient agreed for me to come back. I said, wow, okay. So I'm not fired on my first client. That's great. And I went and I called my supervisor right after, and I told her all the things that happened. And I said, okay, he needs these resources, and this is my plan, and this is what I'm thinking to help him. And then sadly, before I was able to see him again, he passed away. And I remember this experience because I had always thought it's going to be so sad and so heavy when somebody dies. And I remember feeling mixed emotions when he passed away. When I heard that he had passed away, one, I wasn't really that sad and I felt guilty about that. I said, oh, maybe I should feel sadder. And I also felt disappointed because I had all of these plans and the treatment plan to work out with him, and it didn't work because he wasn't on service for long enough. And all of these different mixed emotions that I was able to process with my clinical supervisor. So if you are going through this in any setting, having mixed emotions, totally normal. You're not heartless. It's okay. It happens to all of us. But I realized in that moment, okay, this is different because I had known people who died. And that was one of my reservations is my grandmother had passed away and I was very close with her. And I thought, oh my gosh, if somebody dies, it's going to be a trigger for me and I'm just not going to know how to deal with it. But it was fine because there was that distance because I didn't know that person because that person wasn't my grandmother. That person was a client. And there's that separation, there's that boundary there, there's that distance there that helps to really differentiate between your personal losses and the losses of your clients and your patients. That's not to say that you won't be affected by the losses of your patients and clients, in any setting that you work in. But for the most part, there's going to be a way for you to establish those emotional boundaries for yourself. So I kind of just hopped in there. But overall, the role of the hospice social worker is to provide the patient and the family with support, to provide them with resources, to provide them with any kind of advocacy and help them navigate any kind of ethical challenges that might come up. Same thing with the team. You're also there to support the interdisciplinary team with any kind of ethical challenges that might come up with the advocacy. And the beautiful thing about hospice social workers is you bring the humanity into the medical setting because the doctors and the nurses are looking at a chart, they're looking at a lot of numbers, they're looking at the disease, but you help to paint the full picture of what's going on with this person. Who is this person outside of their disease, outside of the physical body? What kind of personality do they have? What kind of family support do they have? Who are they as a person? And it helps to really piece together the entire person and not just looking at it as a medical patient. So that's part of what I love about being a hospice social worker is you're really able to bring those stories. Also, in addition, you're going to be doing risk assessments, you're going to be doing psychosocial assessments, and you're going to be doing crisis intervention. There are a lot of other things that you're going to be doing, but those are, some of the main tasks that you can be prepared to do. So with this, there are some skills that you're going to need or that you can plan to be developing if you're going to be new to this role. Also, as I'm going through this list, I'm going to share some personal stories that I had of clients, of course, maintaining confidentiality. But just keep this in mind that if you are looking to enter into hospice social work, that these are the skills that you're really going to want to hone in on, to work on, to strengthen, and to be able to talk about if you're going into an interview, right? So first and foremost, you're going to be providing counseling and psychotherapy support to clients who are looking at the end of their life, and you're providing that safe space for them to be able to talk about how they're feeling. A lot of times when I go in there, people maybe with mixed emotions, a lot of times they're generally confused. Like, why is a social worker here? Because typically in our society, social workers are associated with child protection services and we're looking to take your kid away. And that's what they think a social worker is, which you'll probably have to do some education, not only for clients, but also for the medical team as well, that social workers do so much more than that. And so being prepared to be the counseling and support for the clients, the patient, and also the family members as well, because the family members are part of the care team. And a lot of times the family members tend to be forgotten, especially in the medical setting, even though they're so, so important to the successful care of the patient, right? Another role that you're going to be doing is providing psychosocial education. And also, there's so much involved with that. And the psychosocial education is going to be with any kind of resources that the person might need. It could be basic resources such as food, meals on wheels, counseling outside of hospice, how to contact the medical team in case there's an emergency, all sorts of the resources, right? How to get access to the medical equipment that they might need. So whatever the family needs, that's going to be one of your jobs, is to help them try to access it, see if it's out there. A lot of social workers think their employer's insurance has them covered. But here's the thing, that policy is really there to protect the organization, not you. That's why I always recommend having your own coverage with a trusted organization such as HPSO. Their professional liability insurance is designed for social workers and it follows you wherever you work. It's peace of mind you just can't put a price on. Check them out at hpso.com/SWRISE. Hey, social workers, are you looking for clinical supervision or hoping to offer it? Check out RISE Directory. It's the national hub connecting associate social workers with licensed clinical supervisors, making it super easy to find your right match in your state. Head over to risedirectory.com and see how it can help you grow in your career. Another way that you're going to be helping is navigating ethical dilemmas. And this includes ethical dilemmas for the medical team, as far as for your own ethical dilemmas as well. The biggest one that I remember encountering is the right to die, or the End of Life Option Act. So in California, this is a thing where, and there's other states too. I forget all the states, but during my experience in California, there is the End of Life Option Act, which allows somebody with a terminal illness to elect to get medication and to be overseen by that doctor to have medication to end their life at the time that they choose. And so there's a lot of controversy around this as far as, is this suicide? Is this physician-assisted suicide? So all of these things, right? At the end of the day, it didn't matter how I felt about it. It mattered what the patient wanted. And there's a lot of psychological testing. There's a lot of hoops to jump through. This is not a publicly funded option. Like, the family has to have money and resources to find a doctor to do this, to have the doctor oversee it, to afford the medication. So there's really a lot that goes into it. It's not accessible to everybody. One of the people that I helped with this is a patient who had throat cancer. And they were, relatively young. They were younger than their 60s. And they were really scared of dying by their throat cancer, because essentially and this is going to get a little gory, but essentially the cancer in their throat would suffocate them. And they were really scared of just slowly being suffocated. And so they elected for the End of Life Option Act, and it turned out as well as possible. So I was the one who helped them do some research, to help them connect them with a doctor who was able and willing to do this, because the doctor with our hospice agency was not able or willing to be the doctor overseeing it. And so it turned out that the patient was able to obtain the medicine with the supervision of his doctor. And it was a beautiful way of going, if you will, of dying. He had his family all there around him. And they just made it into a beautiful moment. And it gave him more comfort and power and control over that. But I know that has mixed mixed emotions for a lot of people. So being able to differentiate between your own emotions and your own beliefs, and then what it is that your patient or your client is looking for, it is needed, or is their goals, right? Another part of being a social worker is the facilitation of advanced care planning, meaning you're going to help people create like a healthcare directive or designate somebody who can make a decision for them in case they cannot speak for themselves, or establish a DNR or a do not resuscitate order. This is called different things in different states, but essentially saying that should their heart stop beating over the course of their illness, then they will not receive CPR or resuscitation. They can choose to have oxygen machines or not. They can choose to have a feeding tube or not. A lot of times, if you're on hospice, you have come to the acceptance that you have a terminal illness. And a lot of times people elect to have a natural death, which is what kind of how we phrase it is a natural death, allowing nature to take its course and to be as comfortable as possible. And these conversations are very difficult. And there's a lot of cultural variances that come into this as well. For example, I've had a couple clients who, due to their culture, they didn't want to know. They didn't want to know about their health. We weren't allowed to talk to the patient about their health. We had to talk to the family members, and the family members did everything, right? Sometimes only the patient wants to know, and they don't want their family members involved at all. And so it really does take some finesse and some grace to figure out, okay, what are the preferences of this person that I'm working with, and what do they prefer? How do they prefer to have this conversation, which can be really hard sometimes. Another area that you're going to be involved in is crisis intervention. And I remember the most challenging hospice patient that I had. It was a woman who was relatively younger, in her 50s. She lived at home, and her health declined extremely fast. So she was living at home by herself, being independent, and boom, something happened to where her health declined so fast, and she became debilitated and bedbound, essentially. And there was a time that her daughter had to move in. The daughter struggled with her own challenges around addiction, so was not always able to be physically and mentally present for her mom. And one day the mom fell. And so I got a call as a social worker that the client is on the ground, that the patient's on the ground, and they don't know what to do. And the daughter was like, this is just too much for me. And she needs to be placed in a nursing home. Well, the patient didn't want that, but unfortunately she wasn't cognizant, what's that word? Cognitive. She wasn't aware and alert, right, to make her own decisions. And unfortunately, it just wasn't safe for her to stay at home alone. And the patient ended up being placed in a nursing home. And this was just not what the client wanted, what the patient wanted. But unfortunately, it was one of those challenging moments where my ethics were in conflict, right? Like I know that the patient wanted to be at home, but it's no longer safe to be at home. And now the person who she has elected to make medical decisions for her, to keep her safe, to handle her healthcare, is saying like, I can't do this, and needs to go into a nursing home. So that was one of those stories that really stuck out to me. That was really challenging. Another story, and this is another downer, but I promise it'll get better. We're going to have a great story at the end of all these depressing ones. But another way that we help is through conflict mediation. And this skill was really tested for me when I had a client who, again, she was living healthy, and then her health declined very, very quickly, to the point that she was unconscious. I believe maybe she had a stroke or some kind of massive event that she was no longer able to talk. And so the conflict happened because she did not have any kind of advanced healthcare directive in place. So there was no directions for her family around what it was that she wanted should this ever happen to her, should she be alive but unable to speak for herself. So she had two daughters. One daughter says, do everything, do the feeding tube, the oxygen machine, everything, because mom doesn't want to go. She wants to stay here. And the other daughter was on the opposite end saying, mom wants to be comfortable and she would want to go naturally. So it was a really, really hard situation to be in because now the sisters are constantly arguing. There was a lot of family conflict, a lot of tension there. And we had to kind of navigate all of these different dynamics. It ended up that the patient ended up passing peacefully at her home, but it was really a struggle. It was really hard. We got the whole medical team involved, the doctors involved, the nurses, the therapists, the chaplain, everybody. So it really was like a team effort to help to kind of figure out what needs to be done. Right. Another very important skill that you're going to be practicing is patient advocacy, right? So the beautiful part about your job as a social worker within hospice is you get to sit down and spend time with the patients and really learn, okay, what is it that they want? What is it that they need? And be able to communicate that to the medical staff, because a lot of times the doctors, they're very, very busy and they don't have the time to really sit with the patient and explain everything in detail, explain it over and over again so that the patient truly understands it and be able to figure out, okay, given all of this, what is it that you want? What are your wishes? And so that's the way that we can really be the voice of the client and the voice on the medical team. Another skill that you're going to need is interdisciplinary communication. So in most medical settings, all the medical settings that I've been in, there's always some sort of interdisciplinary team meeting, communication between the social worker, the doctor, the nurses, the respiratory therapist, the chaplain, all of the people that are involved in the care of your patient. So it's going to be important for you to be able to communicate clearly and effectively what it is that's happening with the patient, with the family, the dynamics, again, to help paint the picture of the client and to give a full view of what's going on, right? Another core skill that you're going to need is grief counseling. So there's a lot of grief that's going on. There's anticipatory grief, meaning you're anticipating that this person is going to pass away and what that means for you, right? So this happens a lot to caregivers, to children, to spouses. Like, what's my life going to be like once this person's not here? And then also the grief counseling that happens after the person does pass away. Another interesting dynamic that would happen that I wasn't expecting before I started hospice was when the person dies and they are expected to die, but the family feels like they died too soon, meaning the doctor, the medical team says, okay, we're expecting this person to live another month or two. And then the next week, something happens and the person dies. And they have this grief of like, I thought I had more time. They just died too soon. That can also be another really challenging situation as well. And the last part that I will mention is the self-care, because a lot of this is super heavy and you will be forced to figure out what kind of self-care do you need. And that means you have to have the self-awareness of, okay, today I'm really not okay. Today, this was a really challenging situation, and be able to be honest with yourself. Like, I'm feeling tired. I'm feeling overwhelmed. I'm feeling really sad, or I'm feeling hopeful. I'm feeling optimistic. That was a really heartwarming experience that I had. Right. So there's so many different ways, and it'll really force you to look inside yourself outside of the self-care, outside of the physical, but into the spiritual realm as well. because people at the end of their life, they have a lot of spiritual experiences that aren't necessarily explained by medical technology. For example, it's extremely common, about like over 80% of people who are on hospice have visions of loved ones who have passed away, or they have visions of the other world, of heaven, of seeing the light, of feeling this overwhelming peace and joy and love. A lot of times people will say, I want to go home. And the medical team will attribute this to being confused or not knowing where they are. Because if they are at home, they'll say, well, you are at home. But so many times they're talking about their spiritual home, that they feel this longing, this urge to spiritually go home. I had this experience of these two sisters. One of the sisters was on hospice, and the other sister lived at the home with the patient. And they were very spiritual. They were very strong in their faith and their belief in God. And when I did the grief call after the patient died, I said, I asked her, I expressed my condolences and just wanted to check in with her and see how she was doing. And she says, I'm doing great. I'm wonderful. I know that my sister went to heaven. And she told me about the experiences that happened in the home just a couple days or even hours before her sister died. So one of them being that they were both sitting in the living room, and the patient looked over to the side and says, oh, I can see the door of heaven. And she described that there was this door in their living room, that it was open and it was so bright and beautiful and loving and comforting and safe. And she said, but it's not my time yet. And then the night that the patient did pass, the sister told me that the sister was going to the restroom, and down the hallway, she saw that her sister's bedroom light was on, which she thought that was weird because her sister can't get up. She was bedbound, and she thought, oh, I must have forgotten to turn off the light. And when she went to the restroom, and then when she came out of the restroom, the light was off. And again, very strange, but when she went to go check on her sister, she saw that she had just passed away. And so she attributed that to the light of her sister's spirit going to heaven, which I thought was a really beautiful story. But it really helped me to reflect on my own personal beliefs and my own spiritual experiences. So that was a really unexpected way that hospice impacted me. And should you choose to go into this field, it'll probably most likely impact you as well on some level, right? So that is kind of it for the main things, right? I talked about the settings that you would expect to work in. We talked about the role of the hospice social worker, the skills that you are going to likely need as a hospice social worker. I'll tell you briefly the salary. It varies. It varies anywhere between $60,000 to $70,000 per year. This is on average, right? So there might be some lower, there might be some higher. But a lot of it depends on a lot of different factors. So your location plays a role. States will pay differently depending on the state that you're in. If you have more experience, then you will qualify to make higher pay. The employer matters as well, as far as their ability to pay higher wages. And also, if you hold any kind of advanced licensing, so you're likely going to be paid higher if you're an LCSW, if you're a licensed clinical social worker, or if you have some sort of certificate, versus if you are a bachelor's level or a master's level. Sometimes you can't even, you have to have a master's to do the work. Again, it depends on the state, on if you're licensed and all of those things. So if you're interested, do some research and see what it is that you find for the salary. I would just search hospice social work jobs and then your general area, and see what comes up. Read the descriptions, go through, see if it's something that you would be interested in. If it is, figure out what kind of skills that you may already have in your back pocket that could help to apply to the role. If you have even like a 50 or 70% of the qualifications, I would encourage you to go ahead and apply, because you never know. And a lot of times, depending on the location and the agency, they may really be in need for social workers. So shoot your shot. The worst that they can say is no, and you have nothing lost, right? So that is it for me today. If you got anything from this episode, please, please, please go into the app wherever you're listening and give me a 5-star and let me know what you thought about it. If this episode reminded you of somebody that you know or somebody that's considering hospice social work, go ahead and send it to them. Just open it up, send it to them via text. They will love it. Also, you can find me on Instagram. If you want to stay updated on the podcast and episodes and what we have going on, then make sure to subscribe to my email list. The link is there in the show notes. And with that, that is all I have for you today, my friend. I'll talk to you later.